So Newville Clinic is in need of an electronic healthcare record system. Newville is a growing healthcare facility serving upwards of 15,000 patients, many of which are of the elderly age group. At this point in time, Newville has about 50 clinical and clerical employees. At present, Newville uses paper patient health records. The larger issues with the usage of paper record keeping are compliance and regulatory based. Many of the practices of Newville do not currently meet the standards of HIPAA. Paper record keeping is very inefficient between the space required to store the records and having to find the records. A needs assessment was conducted between employee surveys and patient satisfaction surveys. Upon gathering this information, it was found that the computer systems needed an upgrade. The operating systems and software were very dated, which contributed to the inefficiency of the clinic. A cloud-based system of storage would be ideal due to the amount of patient records kept at Newville. A cloud-based system, often known as cloud computing, is a broad term for anything that involves the delivery of hosted services via the internet. That's a quote from Unity Communications 2022. Insurance verification and billing will also need to be built into the new EHR system. Given the number of elderly patients, having a system that can better bundle services can save them money. A lot of their insurance with Medicare is fee-for-service based, which can add up and become very expensive. A transportation system that integrates with scheduling would also be ideal for the elderly population. Many struggle with access to care due to limited transportation availability. Instituting a system that will set up patient transport will ease the difficulties that these patients face. So in our research, we found that Epic is going to be the best choice for Newville Clinic. There's a number of reasons why. The main reason that Epic has been chosen is that it is able to be used in a number of specialties. We looked at a software comparison between 3 different systems, and Epic encompassed the most specialties. Newville provides a number of different services to its patient population, from primary care to specialty care. Epic stores patient records via a cloud-based system, eliminating the need for patient record storage. Accessibility for patients is also accounted for with Epic with the MyChart mobile application. This application allows patients to schedule, reschedule, and cancel appointments. The app also allows patients to receive lab and test results in real time. The way in which we will alleviate patient fears associated with electronic data is education. Electronic data allows healthcare providers to better track and diagnose illnesses. This may also lead to development of new equipment to better serve patients. An example would be minimally invasive surgeries via new technologies. This means less time to heal and definitely a less of an impact on the lives of those patients. Patients will be able to interact more easily with their healthcare records and information. Using the MyChart app, they will have real-time access to results. Patients will also be able to send messages to their doctors. This will eliminate long hold times or waiting on the phone, or waiting hours or days for a call back from someone. Epic is HIPAA compliant, meaning that any information shared via Epic is secured due to HIPAA standards. Epic is also compliant with ICD-10 and CPT, which creates ease in insurance and billing. Epic is also HL7 compliant. HL7 compliance means that those using Epic have ease of access and record sharing between electronic health record systems. IT will do regular monthly audits into Newville's EHR system to find breach sensitivities. Given that the Epic system is HIPAA compliant, they are subject to civil and criminal penalties. Should patient information be misused, they will be penalized. This gives EHR systems like Epic financial incentive to make sure that they remain HIPAA and high-tech compliant. As stated previously, data will be stored in a cloud-based system. Data will be secured by a HIPAA and high-tech compliant security system. Electronic health records will all be subject to a certain level of encryption. Cloud-based security will also be integral in order to keep data safe. Data stored by Newville will be used in the effort to continue growing. This means that based upon patient needs, Newville will keep improving care and technology. This data will also give insight into preventative healthcare for future patients. So as far as the implementation plan goes, we will have a task force. This will be spearheaded by the CTO or Chief Technology Officer. The role of Chief Technology Officer will adapt over time as the electronic health record continues to evolve. The CTO will lead an IT task force specifically contracted for the implementation of the Epic system. The scope of implementation will cover data migration, training for clerical staff, training for clinical staff, and a staggered go-live schedule. The time frame we're expecting for implementation of the EHR will be 2 years, barring any large issues. The implementation approach will be to go live in a new department each month. This will give the IT task force time to focus on this particular department and fix any errors. Staff within the department will have one-on-one time with Epic trainers. The infrastructure will hold its basis in computer system used by clinical and clerical staff. Patients will be assigned medical record numbers for easy lookup and referencing. Each computer system will have Epic installed and draw records from the cloud-based data storage. Clerical staff will have duplex scanners available for easy upload of patient records. This implementation plan will follow Cotter's change management approach. Cotter's change management approach consists of 3 phases. The first phase is creating a climate for change. Second is engaging and enabling the organization. And third is implementing and sustaining changes. Involving the clinic staff in the change process throughout increases the likelihood that they understand the need for the change. This change management plan also requires a champion to be selected to lead the change. Each department at Newville will have a physician that leads the change management plan. Efficiency of the EHR will be highlighted for the staff. Data will be shared that stresses the amount of time saved in using an EHR versus a paper record-keeping system. Staff members will be sent to training retreats that allows them hands-on experience with Epic system. Staff will need easy access to IT members in the event of a system issue. An IT help desk request system will be put into place so they can email issues. This way, the staff will be able to continue working IT while IT works on the problem remedy. The training will be done in rotations for all staff members. This means that no department will be left short-staffed in the process. Each staff member will attend a retreat-style training and have regular training that can be easily completed during the workday. A beta test of the system will occur in the outpatient clinic. The IT department will be on hand to help with any issues that may occur. Epic system specialists will also be on site to walk staff through using the system. Staff will be prepared for the go-live date with regular updates via an email newsletter. Patients will be notified of this exciting transition in a number of ways. These methods will be social media, posters, and television commercials. The Epic EHR system will continue to be updated and optimized on a regular basis. Newville will have representatives available through Epic to help set up any new upgrades. The IT team will keep data records of any issues that the system experiences and report out to Epic reps. Staff will also have regular monthly surveys for the first 2 years to be able to tell what may not be working. We're really excited for this new implementation, and we look forward to the increase in efficiency and for our patients to notice how great the system is going to work. So thank you.